gentlewoman is recognized for 5 minutes in support of the amendment.
Thank you, Madam Chair. This bill rolls back the historic progress of the ACA by facilitating the growth of association health plans, often called junk health plans. Association health plans would be exempt from the requirement to cover essential health benefits like mental health, hospital services, prescription drugs, and pregnancy and newborn care. My amendment would simply require that association health plans cover prenatal, childbirth, postpartum, and newborn care. If this bill were enacted without my amendment, these association health plans would not be required to cover any costs of care during pregnancy, childbirth, or infancy. We have a maternal mortality crisis in the United States, with maternal mortality rates in our country more than 3 times greater than other similar countries. This is a health equity crisis, too, because Black pregnant people are 3 to 4 times more likely to die from pregnancy-related causes than white pregnant people. Passage of this bill without my amendment would only make it worse. If a person became pregnant while enrolled in an association health plan that does not cover pregnancy and newborn care, they would face huge medical bills and worse health outcomes. Health costs associated with pregnancy, childbirth, and postpartum care cost an average of $18,865 without insurance coverage. If an infant needs care in the neonatal intensive care unit, it would cost an average of $3,500 per day. Pregnant people in association health plans could be fully responsible for these costs while also paying premiums and copays for all other needed medical care. Aside from giant medical bills, pregnant people without health coverage for prenatal care receive fewer prenatal services than their insured counterparts. They report greater difficulty in obtaining needed care, and they have poorer health outcomes during pregnancy and delivery. Newborns without health coverage are more likely to have adverse outcomes like low birth weight and death than insured newborns. Health coverage for pregnancy, childbirth, postpartum, and newborn care are proven to reduce both maternal and infant mortality. Specifically, expansion of Medicaid under the ACA resulted in a decrease in maternal mortality of roughly 18% due to expanded prenatal care. Similarly, newborns with health coverage are over 2 times less likely to die than their uninsured counterparts when hospitalized. Supporters of association health plans may claim that the free market will lead most plans to cover pregnancy and newborn services without a statutory requirement. But history shows us that that is simply not the case. Before the ACA required coverage of essential health benefits, only 12% of plans in the individual health insurance marketplace offered maternity coverage. Democrats have worked for decades to increase access to and affordability of prenatal, postpartum, and newborn care. Under the ACA, Democrats made pregnancy and newborn care essential health benefits to ensure coverage in all types of health plans, including Medicaid. That substantial expansion of pre- and postnatal care led to earlier initiation of prenatal care and improved postpartum care. Medicaid expansion under the ACA has prevented over 250 maternal mortalities per year. In the American Rescue Plan, Democrats enhanced pregnancy and newborn care even more by giving states the option to extend Medicaid postpartum coverage to 12 months after birth, which 48 states have already done or are in the process of doing. I urge my colleagues across the aisle to join us in expanding and improving prenatal, postpartum, and newborn care instead of pushing bills like this that strip vital care from people who desperately need it. Opening the door to expand junk health plans will harm pregnant people and their newborns. Unsuspecting enrollees will be hit with tens of thousands of dollars in medical bills for pregnancy, childbirth, and newborn care, or they'll forego that care and face substantial complications and potentially death. My amendment would ensure that prenatal, postpartum, and newborn care are covered under association health plans. This care is vital and life-saving, and Congress cannot and must not allow loopholes for health plans not to cover it. I urge my colleagues to vote yes on my amendment to protect the lives of pregnant people and infants across the country. And I yield back the balance of my time.